An advocate of the Affordable Care Act visits Worcester Tuesday. Linda Rosenberg has been working with Congress to fight against repealing Obamacare. Today, she spoke to hundreds in the city about the major concerns she has for behavioral health care.
We will be judged by how we treat the most vulnerable amongst us, and this is not looking very good.
Linda Rosenberg calls repealing the Affordable Care Act dangerous, especially for people suffering from addiction and mental health disorders. Speaking to a large crowd in Worcester, the president of the National Council for Behavioral Health says the new proposed healthcare plan doesn't suit all Americans.
For people who believe that health care is a right and not a privilege, this is a very difficult time.
President Trump's proposed health care plan allows insurance companies to decide whether to cover mental health and addiction treatment. Under the Affordable Care Act, it was mandatory.
We're taking care away from people in desperate need. That's going backwards.
Access to health care is vital to keeping them alive, keeping them out of jail.
The Association for Behavioral Health Care hosted Rosenberg at the annual meeting. President Vic DeGravio says repealing the Affordable Care Act would impact hundreds in Worcester.
We're very concerned. The repeal of the Affordable Care Act, Obamacare, would be tragic for many of the folks our members serve.
We treat a number of individuals with Medicaid. There is a large amount of Medicaid cuts that are in place. We're concerned about that. It's a significant hit to our state as well as all the other states.
DeGravio says Massachusetts has shown a dedication to helping behavioral health care, but the state's budget could also be affected.
The state budget would potentially be affected dramatically. I think the Baker administration is projecting that if the Affordable Care Act is repealed, it could cost Massachusetts $1.9 billion annually.
Rosenberg says she has a lot of work ahead of her in D.C. to fight for behavioral health care.
We want to make sure that whatever replaces the ACA maintains the essential health benefits, that it shores up the exchanges, and that we protect